Hello everyone, I would like to present not all the insights in digital health, but to share with you our vision for the healthcare in the future, and also our ideas to build this, and of course somehow our contribution so far to implementation of these ideas. Now we're talking about neurodisease, and especially for questions like detection of the disease, diagnosis, treatment, forecasting, and prevention. So this means a lot of prognosis is in sight. Let me see. Yes. So this slide is about the situation now, and which will continue in the future. So this is the age of artificial intelligence, but this is the age of intelligence in general, and we may use this intelligence in all the areas of our life to make our life first better, second easier, but the most important, everything which concerns our life to be in our hands. So I think now is the time that everyone can take the health care for his hands. Okay, we started with the human brain. We start to study human brain, probably the most complex system of the human body. And now in this slide I'm showing on the left side how many influences is taking human brain. This is oxidative stress, this is aging and traumatic injuries and many other things, including, of course, genetic mutations, etc., etc. So on the bottom, it's a classification, a simple classification of the neurological diseases. There are two main types. This is neurodevelopmental disease, which are normally by birth. You can see on the picture on the left, the young girl and the young brain. He starts suffering from some kind of disease. For example, this is autism, this is epilepsy, etc. So the second branch, important branch, are neurodegenerative diseases. You see the old man with his brain over there. So this is like Alzheimer, Parkinson, all kinds of dementia, different type of dementia. And in the middle, these are all the sleep disorders, migraines, etc., the things are, which are happened in the brain. Okay. Now, first direction of our work is creating biomarkers for each of the particular diseases that we are studying. What is a biomarker? Biomarker is, let's say, a calculation based on the data collected from the patient, which can, how to say, clustering people. For people which are absolutely has nothing to do with this particular disease that we are studying, the people that they already have a disease, or the people that they have a higher probability to become patients. So these are the biomarkers. Everywhere, all over the world, all the teams which are working in the field of neuroscience, and we call this translational neuroscience because we are trying everything we build immediately to translate to the clinical practice. So all the teams, they're developing biomarkers. There are thousands and thousands of biomarkers which help mostly in prevention. If you go to the laboratory or to the doctor and you're making a list of examinations, there is a word biomarkers. Biomarkers for this, biomarkers for that. If the biomarkers are above certain level, you need to do another test in order to prove or disprove the hypothesis that you're suffering or you will be a patient very soon. So this is really important thing, and how we are doing this, we're doing in a little bit different manner than most of the teams all over the world. We are modeling with different instruments, different models, not only mathematical, but biological, etc., models. We are modeling the disease. And then we are studying the disease in order to find the biomarkers which reflection, which projection will be the disease. So why this is important? Of course, it's important. This is about early detection. It gives a possibility for a screening campaign for important diseases, and this, of course, gives a possibility to fully personalized diagnosis, or we are going to the personalized medicine. Okay. Now, biomarkers. I talk about how important are biomarkers for the patients. Okay, but they're important for the doctors as well. And through the doctors, the knowledge of the doctor reinforced with the biomarkers gives a direct impact to the patient. And the patient gives a direct impact, the health of the patient gives direct impact to the community and to the society. So this is the whole circle of impacting of everything we are trying to achieve. Let's continue. This second branch of our work. Okay, first one was to create biomarkers in order to prognose something. But of course, the disease has symptoms. And these symptoms could be hazardous for your health, could cause a death, for example. So it's really important to detect the symptoms of the disease and to stop them or to help the person. I will give you a few examples. SUDEP is a sudden unexplained death in epilepsy. It normally happens at the end of the seizure. When the person with epilepsy gets a seizure, at the end of the seizure, most of the deaths are at that moment. No one can explain why, but we can, if we can detect in real time the seizure, we can alert to someone, for example, to the nurse or to the parents of the patient or to his relatives, and they can help him. The second one is SIDS, for example, in newborns, which are between 0 and 6 months old children. There is something like sudden infant death syndrome, which is caused by the fact that the baby forgets to breathe, and he just, without any particular external reason, stops breathing. So if we can detect this moment in real time, we can help him. For example, this because the baby is sleeping too deep. So we can switch on the music and wake him up, or do something with the crib in which the baby sleeps, to move the crib in order to do something. And many other things like that. So this is mostly treated the usage of ideology of computer vision in the human health. Here I have one example. I saw that it's really difficult to start a movie here, but I'm trying to show this. This important example, you will see one epileptic seizure, which is absolutely difficult to detect if a trained person is detecting. You see, this is normal during the sleep, normal movement of the small girl, and now is coming the tonic phase of the seizure. Tonic phase means that in some strange pose, you are freezing for several seconds, and then the motor phase of the seizure starts. Now I will tell you where it will start. It will start under the blankets on the place where the picture is. You will see probably. This, yeah, you see now? It starts moving, yeah. But, no, this is the end of the movie, but it's really difficult. Suppose one guy is working on 25 screens. It's almost impossible for him to find this and to alert for this, but this is a real seizure. And now you see our detector, which is working in real time. He catch the first movement, which was violent, but not a seizure, but he catch the whole seizure here, immediately and alert in real time. So this is very important, and now we implemented this in one clinic, in the clinical facilities in the Netherlands. Why in the Netherlands? First, because we have a contact and very good connections with them. Second, there is no epilepsy clinic in Bulgaria. So we went abroad to test this, but the patients, the doctors, and the nurses, they are really happy because this helps them. For example, one nurse can take care of, for example, 10 rooms with 10 patients, while before it was 2 or 3. So now it's much more efficient. Okay, now we try to expand our area of interest. We said, okay, but let's detect falls, because when you fall down, it could be because you are not concentrated, okay, and you fall down. But you can get hurt when you fall down, but you can fall down because of the heart attack, for example. You can fall down because someone hits you. So if we can monitor, for example, a place like a public mall or a stadium or a concert hall, and detect those things, we can send immediately the medical teams there. So first, we teach ourselves to follow an object. If he's a patient or someone who is just walking, we are using the same algorithm to follow him. Then, but this was originally with a single camera, so this is our patent in this area. Then we try to add more cameras. Why? Because normally, in all those facilities I was talking about, like malls and clinics, etc., the cameras are already there. So you need to put a specific device and equipped with the software, which will read the cameras and alert for some hazardous event. And here you see my colleague is doing an experiment with 2 cameras, and the machine learning inside and artificial intelligence is between the cameras. One camera is learning from the other and the opposite. Here with the 2 cameras you see, he's using a wall. He's going behind the wall. One camera stops here and waiting for him, and the other camera catches him on the other side of the wall. And finally, you see very fast and very perfect, how to say, tracking, together with detection of the falls. This my colleague Simeon Karpuzov, who is running over there. Okay, so now we are starting implementation of the device who is responsible for detection and alerting of epileptic seizures for home use in Bulgaria. This is our plan for the next month. And what is the future? As you see, hospital everywhere, mall, stadium, intersections. We can make a conclusion that in the future, the healthcare is actually all around. Thank you for the attention.